Hey everybody, welcome back to our HCBS Educational Series. Today we're diving deep into a topic that almost every family and or member asks me at some point, and that is PCS. If you've ever wondered about what PCS is, how does one qualify, how many hours you may have, and what exactly caregivers do under PCS, you're in the right place. By the end of this video, you're gonna know exactly what PCS is, how it fits into Kansas's Medicaid home and community-based services, and how it can make day-to-day life easier for you and the person you love. Let's start simple. PCS stands for Personal Care Services. Think of PCS as hands-on assistance with tasks that an individual may not be able to do safely and or comfortably alone. This might include things such as bathing, showering, dressing, grooming, brushing one's teeth, perhaps helping with meals, preparing and serving, or even gentle reminders to eat. Also included in those is light housekeeping that's directly related to the individual's care, like changing bed sheets and wiping the counter after a meal. Here's an easy way to picture it, and how I explain to most of our clients. If it's an everyday task that you need to perform to keep yourself clean, fed, and moving safely, and you just need a steady hand or a gentle reminder, PCS may cover it. PCS isn't just about chores and tasks. It's about dignity and independence. Studies show that when people start getting help with personal care, they stay at home longer, stay healthier, and feel more confident. I think about a gentleman I work with, Mr. Ray. What's going on, Mr. Ray? I know you're watching. Mr. Ray came to us a couple of years ago. He loved tending to his vegetable garden. Unfortunately, after a few hip surgeries, he was in significant pain and could not do anything. With PCS hours a few times a week, he was then able to bathe safely, get dressed without pain, and guess what? He's back to tending to his vegetable garden. He came to me months later and said the PCS support he was receiving gave him his life back. That's the kind of support that surrounds PCS. So let's dive a little bit deeper into PCS. PCS fits into something much larger called Home and Community-Based Services. You remember? HCBS for short. HCBS is Kansas's Medicaid's way of saying you don't have to move into a nursing home to get help. If you or your loved one meet the income and medical guidelines, you may be able to qualify for an HCBS waiver. And remember, each waiver covers different supports. For example, PCS is covered under both the physical disability waiver and the frail and elderly waiver. So how do you know if somebody you love or yourself qualifies for PCS and or how many hours you have? Well, here's a simple version. First, there's going to be an assessment. A qualified and state-approved nurse or case manager does an assessment in the home. During this visit, they're going to perform an assessment based on the things that you need help with, whether bathing, moving safely around the home, or any other personal task. During the plan of care, the individual is going to determine how many hours a week you need assistance. This can range from a few hours a week to daily support. Next, you're going to choose your agency. There's a couple of ways to go about this. First, you can visit KDAD's provider list. That's the Kansas Department of Aging and Disabilities provider list. I'll be sure to leave a link down below in the comment section. Or you can check with your case manager. More than often, they know the providers in your area, and I'll be totally truthful, they know the ones that are consistent. And if you're still having a problem finding a consistent provider, reach out to the Zara Case team. We have social workers on standby, ready and willing to help you find a provider that fits your waiver type. Remember, the hours allotted are not random. I can't say this enough. They're not random. They're based on your or your loved one's assessment. So clear, honest answers during the assessment. Don't leave out any details because nothing is too small. If you need help with this task and others like it, be sure to let the case manager or the nurse assigned to your case know. So with that being said, let me break down a few tips and tricks that are going to allow that assessment to go as planned so that you can be sure that you'll receive the amount of support and PCS hours that you or your loved one expects. First, make a list. During the assessment, there's going to be a lot of questions asked. So you want to be sure that you have a written down list before the assessment. If it causes stress and/or worries, you want to make sure it's on that list. And secondly, if you think you have a hard time remembering things, ask a friend or a family member to sit in during that assessment. They don't have to be a DPOA and/or a guardian. They can sit in and help remind you of the things that they see you go through on a daily basis that causes stress and/or worry when performing your daily task. What should be on the list? Well, let's think about it. If you are having any task or daily activities that are causing the most amount of stress and safety concerns in your home, they need to make that list. The next thing you want to do is to make sure you ask questions. There's going to be a lot of questions asked about your needs and how you move throughout your day, but I want you to ask the same amount of questions as well. So ask if this task is covered. What time can I get this task done? Or are there other services that are allowed through HCBS that can help you or your loved one throughout the day? Remember, support is the name of the game. So if you need that support, be sure to ask the nurse and/or case manager assigned to your case. And last but not least, when it comes to the assessments, reassess and reassess. Jerome, what do you mean, reassess? Well, when life changes, you can have a reassessment. Think about it. If you have a surgery, a fall, or even get new medication, or perhaps you moved to a smaller place, or you moved in with family or a friend. All these are life-changing events that allow you to be reassessed for how much support you need. It may go down or it may go up, but either way, you're going to be reassessed for the support that you need in your home. And don't think that you have to remember every rule. That's what your case manager and provider agency staff are for. I know that the system and the process can feel overwhelming. I spoke to a daughter last week who said all she wanted to do was keep her mom safe, but the paperwork that she had to go through made her cry. After walking through the PCS process and getting a caregiver assigned, she called and said, "I finally feel like I can breathe again." That's exactly what I want for you. Transparency, clarity, less stress, because you know that you or your loved one is receiving the support you need when you need it. So here's today's takeaway. What is PCS? Remember, it's personal care services, which are a part of Kansas's Medicaid HCBS waivers, and it's there to keep people at home safe and independently. So here's today's takeaway. PCS, personal care services, are a part of Medicaid's HCBS waivers, and they're utilized to help you and or your family member stay at home safe and independently. Eligibility is determined by medical need and income, and your hours are going to be dependent upon your assessment, which is done by a state-approved nurse and or case manager. If you found this episode helpful, please click the like button, and remember, you do not have to figure out HCBS programs and waivers alone. We are here to help you navigate you or your loved one's care. We'll see you next time.